Hello and welcome back to MLab 1101, Introduction to Clinical Laboratory Science. My name is Dustin Scott Brewster, and this is going to be the third of our three-part presentation on the first unit, the Introduction to Clinical Laboratory Science. Now that we've discussed the departments in a clinical laboratory, let's talk about the urgency of the testing. Routine testing is the least urgent of the three different categories, and it can be done whenever there is availability and as long as that testing timeline falls within the range established by the facility you're testing at. Next, we have ASAP samples, or as soon as possible. They need to be done with a little more urgency, and again, falling within the time frame allowed by your facility. And the most urgent testing category would be STAT. STAT is derived from the Latin word stadium, meaning with haste. STAT testing needs to be prioritized over other testing and done immediately upon receipt in the clinical laboratory. Next, we have testing categories that could indicate a patient's state or special requirements for the patient. We have pre-op samples, which need to be drawn and tested before surgery. We have NPO, which is derived from the Latin non pros, meaning nothing by mouth. Then we have PP or PC testing. Post or prendial means after eating. PP is post breakfast, and PC means post or after a meal. Now let's go into more detail about the testing personnel you'll find working in a clinical lab. Phlebotomists, as we mentioned earlier, typically work in specimen processing and receiving, and they're responsible for specimen collection. They usually have a high school diploma or equivalent, and certification for phlebotomy is not required but is preferred. Certification can be achieved through taking an accredited course and passing the certification exam offered by the American Society for Clinical Pathology. A phlebotomy program is instituted at Austin Community College and is accredited by NACLS, and completion of this course will make you eligible for the ASCP National Proficiency Exam. Next, we have a medical laboratory technician. These operators that perform clinical testing have an associate's degree with a one-year certificate. Certification for an MLT is required and offered by the American Society for Clinical Pathology. And Austin Community College also offers a nationally accredited program for medical laboratory technology. Next, we have medical laboratory scientists or clinical laboratory scientists and medical technologists. These three titles are all the same and used interchangeably, although medical laboratory scientist is the preferred title. These operators have a bachelor's degree, and that bachelor's degree in medical laboratory science can be achieved by one of three ways. There is a 3-1 program, which requires 3 years of traditional classroom courses at a university, followed by 1 year of clinical courses. There's also a 2+2 program, that is 2 years in a traditional classroom at a university, followed by 2 years of coursework in an accredited medical laboratory science program. Lastly, we have a 4+1 program, which is for students that have already graduated with a bachelor's degree from a 4-year university, and they follow that by going through a 1-year postgraduate training at an accredited medical laboratory science or medical laboratory technology program. Additionally, there are laboratory specialists that may be working in a clinical lab. Laboratory specialists are medical laboratory scientists with several years of experience that wish to go on for further certification. This certification could specialize the scientist in blood bank, hematology, microbiology, anatomical pathology, or clinical pathology. Also working in the clinical lab are laboratory supervisors, which are often specialists. They could have an upper level degree and have several years of experience. In addition to a supervisor, they could be a laboratory manager, also possibly a specialist with an upper level degree and several years of experience. A laboratory director oversees the operations of the lab. They're usually a medical laboratory scientist with several years of experience. Lastly, we have a medical director. A medical director is a medical doctor and typically a pathologist and oversees all of the assays and ranges in a clinical laboratory. So now let's talk about CLIA 88. We discussed this briefly in the timeline in the first presentation for this unit, and the Clinical Laboratory Improvement Act of 1988 regulates the types of testing performed in a clinical laboratory. CLIA divides testing into three main categories. There is waived, moderately complex, and high complexity testing. Waived testing is performed and is often determined to be so simple and accurate, it is very unlikely that an error would result from the testing. It is not necessary to have a certification, and there are no education requirements for testing waived tests. They also do not require proficiency testing for the site performing the waived tests. Examples of waived testing include glucose, hemoglobin, or hematocrit testing on mobile testing instruments. For an exhausted list of waived testing, you can follow the link at www.cms.hhs.gov. Next, we have moderately complex testing. This is mainly manual procedures with limited steps and preparation. It could be an automated analysis, and it does not require the operator or the person testing to intervene during the analytical process. Moderately complex testing requires proficiency testing for the site performing the tests, and if the lab fails, they can be prevented from doing clinical specimens. The testing personnel for moderately complex testing need to have a minimum of a high school graduation plus completion of 50 weeks of military training or other appropriately documented training. Lastly, we have high complexity testing, which is designated for labs that perform all laboratory testing and include highly specialized tests. This typically includes manual manipulation of samples and manual interpretation of results. Highly complex testing requires extensive proficiency testing for the site performing those tests, and the testing personnel must have at least an associate's degree in medical laboratory technology. The Department of Health and Human Services is responsible for overseeing all government agencies that regulate clinical laboratories. They're also responsible for safeguarding the health of the public and provide health services that are essential to maintaining good health. One of those departments is the Center for Disease Control and Prevention, which monitor disease outbreak and implement disease prevention strategies and maintain national health statistics. They also provide immunization services, workplace safety, and environmental disease prevention guidance. They also monitor international disease transmission, and they're also responsible for administering the Agency of Toxic Substances and Disease Registry. Next, we have the Centers for Medicare and Medicaid, or CMS. Medicare is a federal health care coverage plan for the elderly and those with certain disabilities. Medicaid is a healthcare coverage program for individuals living at or below the poverty line. The Department for Medicare and Medicaid control payment for medical procedures, including laboratory services. They regulate and enforce CLIA, and they also enforce Health Insurance Portability and Accountability Act of 1996, also referred to as HIPAA. Also under the Department of Health and Human Services is the Food and Drug Administration. They monitor the safety and effectiveness of food, drinks, cosmetics, drugs, and other medical devices. They're also responsible for determining whether a laboratory test is classified as waived, moderately complex, or highly complex. Professional organizations for clinical laboratory professionals can be found here. Certification agencies include the ASCP, the American Medical Technologists, the American Association of Bioanalysis Board of Registry. Accrediting agencies include National Accreditation Agency for Clinical Laboratory Science, or NACLS, the Joint Commission. It's currently referred to as the Joint Commission. Previously, the Joint Commission on Accreditation of Healthcare Organizations, or JACO, is now known as the Joint Commission. Additionally, there is the College of American Pathology and the Commissions on Office Laboratory Accreditation, or COLA. Professional organizations for the clinical laboratory include the American Society for Clinical Laboratory Science, or ASCLS, the American Association of Blood Banks, the American Association of Clinical Chemists, Clinical Laboratory Management Association, and Clinical and Laboratory Standards Institute. You can follow the links below each of these respective agencies for more information on that organization. Lastly, let's talk about confidentiality and privacy. It's important that all patients have the right to confidentiality and privacy. Healthcare professionals must respect the privacy of all patients. This includes not talking about the patients, not discussing diagnosis or prognosis with anybody except those that have a right to know. Who has a right to know? That is a healthcare professional working with the patient, parents of a minor child seeking treatment. They also keep patients covered when possible. That is included in respecting a patient's privacy and not calling out a patient's name while in a healthcare setting and disclosing their personal information unnecessarily. Patients' privacy are protected by the Health Insurance Portability and Accountability Act, or HIPAA. This was an act passed by Congress in 1996 to protect patient privacy with electronic databases. This was later expanded to include all aspects of patient privacy. For the Medical Laboratory Technology program, or the phlebotomy program in Austin Community College, it is required that all students complete the HIPAA Student Employee Training module. To complete this module, you can go to the following link, click on HIPAA Student Employee Training module, and you'll be asked to designate the health science program in which you are enrolled. Click on Medical Laboratory Technology if taking this course and complete the module, and email to me, the professor teaching this course. So that's going to conclude the first unit of the Intro to Clinical Laboratory Science presentation, and we can pick this back up with Unit 2.